So thank you again for inviting me into this conversation. I am delighted to be here. I feel like I'm at home when I talk to my colleagues, and today it's even better because Joan is here. And where is Joan? Welcome, Joan. Joan and I are served together. I had the opportunity to serve when I was in Delaware, and Joan was in West Virginia, and so I'm delighted that she's here today, and now I'm inheriting what she left in ACYF, and so we have some good beginnings there to further cement and develop based on what she built there. But I see a lot of familiar faces, Jerry and Larry and others who are here, and I'm delighted that you're taking the time to discuss these things. As I look at the visioning map that was on the wall from previous sessions, and the one that you're building today, and I was telling Jerry, we did this back in the 90s in Delaware. When I was in Delaware, we did visioning map, and everybody had a copy, a small copy, in their offices. And instead of having the mission statement and the vision statement on the walls, everybody had the map. And so it was graphic, and hopefully they try to live up to it every day as they pass through the door into their offices. And so this also brings me back to the stages in my life when, the energy comes back when I see these things. And what is important when I was looking at the map there, another one you're constructing here, and what I like so much is that you're not just trying to find the answers, but you're trying to identify what are the right questions to ask. And I think that is what is so compelling about a group of people who, together in the trenches, understand how painful it is and how we have to help each other to come out of this and survive and succeed for the sake of the families and children that we serve. From the moment that I was asked to join this administration, I knew that I would have the opportunity to do that, to serve in a new era of government. President Obama, the first day he was in office, he sent a memorandum to all federal agencies directing them to tear down the barriers, to do anything possible to tear down the barriers to transparency and collaboration and participation. Excuse me. And that stood between the federal government and the people that we aim to serve. In all of those in positions of leadership have had it made clear to us that we are expected to participate in a paradigm shift in public service, that we have to switch the default to setting to openness and engagement of the public and participation of the citizenry in the services that we provide. We are finally beginning to emerge, I should say, out of this economic collapse that has had us engaged in so much of the past 2 years. But I think you all will agree with me that a lot of people are still hurting, that we've seen national institutions and family businesses and thousands and millions of jobs buckle under this economic collapse that have left neighborhoods and families undeniably change. And so the people in the government, the people expect government and those of us in public services or the nonprofit sector to do our job well for their sake, because even though rich people in this last economic turmoil, a lot of rich people suffer, which is different from other situations, but there is one constant, and it's that the more vulnerable people, the elderly, the children and families who live paycheck to paycheck, and the children whom they have to care for, were always the most vulnerable anyway. And that their balance is so fragile and it can be disrupted so easily that poverty is always lurking very near and is never far behind. And so it falls on all of us in this room to really work together to see how best we make sure that there are no big holes in that safety net, and that among the strategies for improvement in government, one of the vital elements that is emerging and that the president has made clear, as I say from day one, is that we need to forge much better relationships with each other, much better alliances, much stronger partnerships, that we not only have to have consistent agendas, but that we have to have one agenda, that we have to plan together, that we have to analyze together, because along the years, for the many reasons that I won't go because you know as well or better than me, we have layered policies and requirements upon policies and requirements. We have rerouted protocols and funding streams, and what we have is a system that is anything but cohesive. And so is when we go through an episode as we have for the last couple of years, it's when it becomes so apparent, my God, if it's even hard for the people who are too big to fail, what does it do for the people who are at the bottom of that ladder? And it becomes even more important then to maximize not just efficiency, because the resources are so tight, but effectiveness, because we want to be sure that the people we are here to serve not only survive, but succeed. And so if coordination at all levels is hard, and we've just been in the last week seeing how even in the face of destruction and devastation and terrorism, it's so hard for agencies to collaborate and work together. So imagine how difficult it is for other circumstances, and how important it is in all circumstances, but in social programs, it is essential, because we all know the problems that the families bring to us don't fit in discrete, separate boxes, and so it takes all of us to look at it, and it doesn't make any sense if we're serving the same families in TANF and Medicaid and child welfare that we make them jump through hoops that are inconsistent with each other. It's not good for the families, but it's also not good for the agencies themselves and the programs. And so what you're doing here is the future. And I want to be part of it. And as I was saying to Dan before, it's like I feel this is my last job, so I'm going to push as hard as I know how to push. And I brought with me a great team. A couple of them are here, David and Frank, and they know that we have to push, because in the beginning of an administration, what you'll find, I don't know if you found the same thing, John, when I came to the Clinton administration in the second term, and by then everybody was sort of situated and everybody knew what their job was. This is the beginning of an administration, and so we're all jockeying for position to see who's going to prevail and who's going to be pushed aside and who's going to move forward. And so I feel I have the least to lose, because I was going to retire anyway. And so I'm here, and they have me, and they called me, so now they have me. But you need a great team behind you to be able to do that, and I'm lucky, such as it is, because we still half of our team not on board, but the people that we have, and you've had David here for the last couple of days, and Frank, so you know what I'm talking about, and I feel blessed that we're able to move ahead this forthrightly, because we have very competent people to help. So I was saying that it's hard on families and it's hard on agencies when they have to jump through all these hoops and they have inconsistent requirements among programs. And we want to change this, and we will change this. We're already beginning to analyze administrative processes and rules. We have work groups going on with HUD, with agriculture, with labor, with education, and working groups is the new way of operating. But what's even more important and even more challenging is we have work groups within HHS. And that's sometimes the hardest thing. So we have working groups with the health side. And the health side, I like to say, has all the money, but they forget that there's a human services side. And we always have to be pushing them to know we are here. And we have the clients and we have the needs that complement the health. You cannot talk about health without understanding that people have many dimensions to them, and that emotional and social health are just as important as physiological health. And you can't have one without the other. So we are always pushing. And so everywhere we go, and when we go to staff meetings and we go around the table and they go, David, Carmen, do you have anything to say? And we always try to come up with something, because even if we don't have anything, we don't want them to forget. We don't want a meeting to go by where we don't say something about the social service side. And so the push, as I'm sure you experience in your counties and in your states, the push also has to come internally within your own agencies. It's not always outside. And we have the same things within ACF even. And we have so many programs, contrary to others that just have like health. We have some 30 programs, different things, from refugees to child welfare to TANF, to early childhood, to community services, to Indian affairs. And so it's easy for people to forget that there are other parts of the same tree. So we're beginning to look at rules, and the big announcement that I have for you today is that I've already approved, and we're getting ready to move out of ACF and into the department, the APD rule that has been over 10 years in the making, the revised APD rules. Yes, thank you. The team deserves that. I've already approved it, and we're getting ready to move it to CMS, and then later to USDA, because we're going to have one revised rule to move to OMB. And so hopefully in the spring, I'm still hoping that we're moving that to OMB after clearance from CMS and USDA. And so I think that's going to be wonderful. And that is, and it's not, hasn't been easy because of our own staff. And it's not the leadership that is against it, is the staff that are entrenched in their ways. And these are so often the obstacles to movement. It's people sometimes don't see the big picture, or they're entrenched in their ways. And this is why this interoperability mentality is so important. We are getting ready later this month to have this training at ACF, because we want to work on attitudinal changes at the same time that we work on, and I'm holding back, and we are late on some discretionary funding announcements that should have already been posted on our website, and you will find that they're not for ACF. And the reason for that, and again, I'll get in trouble with my boss because they're not posted, but the reason they're not posted is because we want to take a whole new look at them after the interoperability training. We want people to look at them with a different scope, to see, is the client at the center? And recognizing that the clients are all of you, states and localities whom we serve, but also our mutual clients, the people who consume our services and who access our programs and services. And so we have to ask, are they at the center of it? What other needs can be met by the same announcement that might touch on other programs? What doors have I opened or have knocked on, at least, to try to get them into this? So consequently, we will have a much shorter time this year for announcements and then for processing, but we will get the money out on time. And hopefully, it won't be perfect this first year. We'll keep improving as years go by. But I did want to give us that opportunity, because this is the first set of funding announcements that are going under our leadership, and I wanted it to be with this new vision. So you can blame me if you don't know yet what funding opportunities we have. I'm happy to say, and this is something that started under Joan's leadership, but we we want to become more active partners in terms of implementation. We have policy obligations, and we will continue to do that, and we will continue to do these allowances, but we will only do this when it is obvious to everyone concerned that we have done the utmost in trying to participate fully, hand in hand with you all, in making sure that the services are rendered as meeting the needs of the clients. In addition to that, there's this whole other side of leadership that we want ACF to become. As Dan was saying earlier, we want to improve our capacity to really be with you all in terms of implementing the statutes and the policies and the regulations. We now have 5 resource centers in child welfare that have to do with the implementation, and I'm excited about that. We have also the National Workforce Institute looking at how do we support workforce issues in recruitment and retention of qualified, committed personnel for child welfare. We're getting ready to do our first in the spring, early spring. We'll have our first of what I hope to be 4 or 5 institutes on planning for children, and we're calling our initiative Caring Communities for Children, and we're starting with the rural aspects of child development. And we don't have a lot of money, but we will give technical assistance to communities who want to come together to plan together on behalf of children. And we will be there with you. And we have a lot of money in technical assistance that we will put at your disposal in order to better plan for children. And so I'm excited about that. That will happen in March. And so you see, we're beginning to move. And as Daniel likes to say, we're moving. So come on board if you want to, because this train is leaving the station. So we're focusing on efficiency across all fronts at the same time that we're having these new initiatives. And we've already started these organizational assessments. We are looking to all our stakeholders, employees and states and localities that we serve, as well as clients, to see how we are positioned in order to take on these new challenges. Do we have the right mix of staff? Stan was saying that in Puerto Rico I have 4,500 staff and only $220 million. Here I have $58 billion, but only 1,500 staff. And so, there are challenges either way. And so we want to be sure that we're up for that. As we're lucky that people are beginning to retire, people who have given their best to the agency and are now making way and leaving room for a new generation to come. And as we fill those vacancies that are being left, I want to be sure that we're doing with the right mixture of knowledge, skills, and attitudes to face these new endeavors. And so if you're asked to participate, and Frank is coordinating that effort, but some of you in this room might be called upon to answer the questions, is ACF meeting your needs? How do you see your work with ACF? Are we well positioned in terms of structure and mixture of staff skills and knowledge and competencies to respond to what you need in the field? And we're looking forward to your ideas about how ACF can really reestablish itself or go further than it's ever been in terms of leadership in human services. We want to become that stellar organization that I spoke about in my hearing. Another thing that we're doing, as I said, is the training on interoperability later this month, and I have high hopes for that. We really want to go into not just funding announcement, but even our data systems and our policies, and do a lot of initiatives across program areas in ACF, in addition to these outside working groups that I already mentioned. So we have a lot of work to do in Washington, but I think the most important work will be done out in the field, and this is why I think your work is so important. what you do there, what works for you, what has the opportunity to be replicated in other areas, what are the adjustments that have to be made, how can we assist in that, how can we get you the right tools for you to do your job, not just the funding, but what are the right mechanisms in policy, the flexibilities that you need in order for you to get the work done. And we stand ready to listen, and we want your ideas. We'll be having a lot of convenings in this term, not formal advisory committees, because then we run into a whole series of requirements at the federal level in terms of advisory committee. But we will be calling upon organizations such as APHSA, NGA, Child Welfare League, to assist us with doing, which they already are doing, excellent work in conference calls and meetings that we can then attend. But we'll also be calling you to come and give us your individual input as to how things should work and what are some great new ideas. And we look forward to that. This is our attempt to answer the President's call for transparency and collaboration and participation and engagement at all levels. And our answer is to do the best possible quality of services for children and families. And I look forward to working with you shoulder to shoulder to do teamwork a notch above what we've done ever before, and to help in asking the right questions and then getting solutions for those questions. So I understand there is a period of questions and answers, and I have people here to help me answer. And so,
in keeping with President Obama's vision, your talk is so wonderful because it gives us hope. We've been waiting for a very long time. We all have a lot of agendas, and the danger is, of course, that we all throw our individual pieces that we're looking for. You know, longitudinal data. Barbara will talk to you about that. I'll talk about that too. But, you know, we'll go through a whole list of things, and that may not be the most helpful way to get you started. So you're doing a lot of work internally. Tell us, for counties, for states, for advocacy organizations, for national organizations, what's the best way for us to help you drive the changes you're trying to do within HHS?
Thank you. Well, first of all, let me say we do want all. We want everything. We want your ideas. We will work at organizing them and putting them together, and that's why we have staff. We want ideas. We want information about what you're doing that is working. You know, a lot of our channels for communication come through states, and we want to maintain that. States are conduits to the field. In some instances, communities directly. And we want to maintain that. But additionally, we miss a lot of what is working, because even at the state level, when I worked in Delaware and Puerto Rico at the state level, it was very different than when I worked in Virginia at the state level, because Virginia has local administration. And a lot of wonderful things were happening at county levels that we didn't even know about, let alone support in Virginia. While in Puerto Rico and Delaware, we were it. You know, we were the driving force. So I want to be sure that things are happening at a local level that we know about if it's working, and that we can then help others and learn from it. But we also want, and so data, because we're going to be doing a lot of work on better organizing data and learning from data and having data that is more timely. You know, no more of these putting out a congressional report or an NCANS report 5 years after the data were collected. That doesn't inform policy, and that doesn't help anybody. So we made a commitment that we will issue a congressional report no later than the following December after the data are collected. For example, NCANS is collected May. So the report will be issued December of the following year at the very latest. And so that's another big commitment that we are making. I hope we will live up to that. So we want that, but we also want your ideas for research. You know, one of the issues that will be different now is we're going to pool all our money for research. And So we have a lot of more flexibility in terms of, again, interoperability, questions that cover more than one program. So if we're looking in early childhood, are we looking at emerging populations? What are the linkages with child welfare? And so research questions, I'm all into, what are the right questions we should be asking and investigating? And we want your ideas about that as well.
Recently there was a panel, actually spoke to a little bit around with Medicaid and with FNS and with ACF, beginning to talk about that kind of collaboration. Absolutely.
As I say, we have working groups for every possible issue that we can think about. And Joan Lombardi and Kevin Concannon, and we're with Medicaid, Center of Medicaid Services, exploring, what are ways in which we can use data and also look at policy revisions to help with health disparities, emerging populations, early childhood, the linkages between health reform and child welfare, health reform and TANF. We're looking at all of those things. We're looking at rural initiatives. We're looking at urban initiatives. And these are from the White House directed. We're working with the Department of Labor. We're working with HUD.
And the room have been doing so much great work. UMA in Montgomery County, our colleagues in Alameda in California, all of Florida. And the Medicaid waivers, imagine combining Medicaid waivers and child welfare waivers and looking at longitudinal data to really demonstrate the effect of that. I'm trying to get it all in, Barbara.
She paid you for that, I know. I saw her talking with you at breakfast.
Thank you for your support.
I will look forward to that. Count on that. We will convene all the waiver agencies, certainly at least initially the 4E waivers, and then move from there. Excellent. Thank you. We are very hopeful that we will be able to renew some of the waiver ability that we've had. Now, we'll be selective as to what is it that we want to learn and experience through waivers, and but we will push for that. We believe in that, and we think that flexibility needs to be brought back to, and I'm thinking particularly in TANF, but also child welfare. And we will be doing a lot of work with that, and we're working with our general counsel on that right now as we speak. And that's something that we will also push for in reauthorization in both of TANF and CCDBG. Yes.
Follow up to that question Joan asked, and also I'm thinking your point about rural communities as an example. One of the areas that we're seeing across the country right now on the health side is that on this question of I'm thinking of the overlap of the themes that are relevant to ACF and to the health care world. On the question of access to care and measurement, there's a lot of attention to rural communities. So you have agriculture funding telehealth, you have community colleges now through ONC getting funding for workforce development. You've got CMS trying to figure out on state Medicaid plans how they address that. And you've got HRSA and others funding community health models. And we've heard here in the last few days of some states, including Governor Manchin's state, where the focus on access in rural areas is starting to turn into what types of community providers sit at the center of that. And on the health side, that is increasingly community health centers or medical homes. And so a thought would be that when you use your technical assistance on the rural, that perhaps you start talking about how you intersect ACF at the federal, state, local level into the medical home strategy. Because I tend to think that if you got on the ground in that level, you would force, just by doing it, you would be getting the sufficient outcomes to support the kind of change that otherwise might be stymied internally within the organizations. I agree. Because everybody's out there already on this.
I agree completely, and there are some issues that are just so wonderful for it. One of the Secretary's priorities is childhood obesity, for example. And so in this panel that was mentioned earlier before, we are looking at how can Head Start, early Head Start, child care, child welfare connect with the health side in order to bring about real changes. Dr. Howard Koh, who is the Assistant Secretary for Health, has done a lot of work in health disparities. And he's very interested in this, particularly for minority population. And so, he is driving this effort, and I think this will present a wonderful opportunity to really explore and experience how we work together around one issue as opposed to around programs and services. And so we're putting a lot of hope on this childhood obesity, and we're devoting staff resources to see that it's successful. And
just a quick follow-up on that. When it was on a panel yesterday, it was called Health Choice Network out of Florida that is doing school health. And by the way, when I'm saying health, what I'm really getting at is we transform the definition of health so that it's inclusive enough to drive the other, right? But they're doing medical home school health work in Miami-Dade schools. They probably are already connected to ACF providers. And in my background, I was formerly Secretary of Health in Massachusetts, and Howard was my Commissioner of Public Health at the time. That is just what I'm really getting is through Daniel or others that maybe we feed information back to you on a few places where this train is already moved, and you may already be in the room or on the train, so that you can frame it across federal agencies.
Excellent. We will pursue in Miami-Dade. And, and I think the rural area is also, because of the connection to children obesity in rural and poor populations, is also a scenario to start propelling this.
I'm Cheryl Austin-Kesnoff. I was with HRSA. I'm not anymore. But Miami is one example. But I think the key there is an electronic health record that is with the child, that connects them back to a medical home. And if you think about how many of your programs have health components involved, like Head Start and foster care, and we heard so eloquently yesterday how information is not traveling with that child. So I think looking beyond the health center itself to many of those health centers, including in rural areas like West Virginia, are completely electronic now, and making sure that that information can travel with all of those children as they move through your programs as
You've
well.
heard about the Beacons of Health grants and community grants, and that's exactly what they are pursuing.
It's just so wonderful to hear from you. It really does give us a lot of hope. The one point I wanted to make, at the local level where a lot of integration is happening between public health and social services, and we're working for a long time to actually benchmark outcomes, to integrate practice. One of the things we're finding in local government, particularly in this very difficult economic times, there's a lot of money and a lot of grants coming out of HHS, different parts of HHS, but for truly integrated work, we're always outside the fold. So either the driver is electronic health records, and that's what they want to use as the driver, and there's not a room for social service integration, or there is a grant coming out that focuses on adoptions, but it doesn't include the public health side of the house. And really, as frontline county-level administrators, it would be really, really nice if all parts of HHS were able to put out some interoperability, integration grants where local experiments that bring, in part, what Bill was talking about, whether it's local, rural, or it's suburban, or it's urban, but some opportunities for us to actually operationalize the work and demonstrate and evaluate the work that we've been doing for some time. And each time we try, we have to squeeze ourselves a square peg into a round hole somehow, just so we can qualify for a grant. And it would be nice to have some innovative approaches to be encouraged in that way.
Well, I agree completely. This is why we're beginning with the Caring Communities for Children, where we don't have money, but we have the technical assistance. All of us in the human service field, particularly in the social service field, know that the way we have survived through the years and thrived through the years is hanging our hat on somebody else's peg, because we never have the money to issue. Well, that is still true now. And the money is on the health side. But I think that we're beginning to see the awareness. Now, a long time ago, I decided, as you, because your presence here is testimony that you think the same way I do, is that a long time ago we decided that we're moving forward. And hopefully the work that we are doing will spill over and convince a few people to want to do some of the same thing, because we are happy, successful, accomplished, and even if we are, like a duck under the water, we're struggling to survive above the water. But this is what we're doing. And so at ACF, we're starting with interoperability within ACF. But we've already informed the secretary and the deputy secretary, and all eyes are on us to see how we do with this. And my hope is, and because we're beginning to see all this working group energy, and we have a lot of meetings in which we go and we talk about our needs and our situation and the facts out there among the people that we strive to serve, that it will end up spilling towards the other side of the house. We're starting with ACF, but I agree with you. And so, we're trying to approach it from all possible angles. Truth is, we had the money from ARA funding went to TANF and went to Head Start and Early Head Start and community services. And in all those areas, we are making a point that we are looking outside the program boundaries. We've issued, 3 sets of guidance now on TANF, how to use TANF dollars, ARA funding, for domestic violence and for adolescent pregnancy. And, we're trying to help people. These are always available to people. I mean, we're not changing the rules. They were there. We're just helping people because we're interested in this implementation level that I spoke about earlier. We're telling people, hey, you can use this money for such and such. And that's what we're doing without having had to change any rules or any policies. The same thing is what I'm hoping you all do at your level, that this money is there, that you're thinking, how can I fit in? The same thing you just described. How can I fit in here? How can I do this? And think creatively so that these funds can apply to what you're doing or would like to do. And so I think both of us can work on that.
I'd like to encourage you to add to that comment, to not look top down but bottom up. There is, and we're a single state agency in our state, so everybody reports to the governor. You would think that it's the most dysfunctional way to do it. We work together better than, I would argue, any other state that has a comprehensive HHS agency. And the stories that we've heard this week from the Montgomery's counties and other stories that we've heard, the success stories are happening at the state level, at the county level. And if you all at the federal level would let loose of some of the rules and regulations and stop making them so damn complicated so that we can't do what we need to do for the children we're trying to serve, that's the biggest victory, not letting the money, and money is important, and believe me, as a Medicaid director, I know that. But the work is happening, but instead of technical assistance up, down, y'all should look at, and not just your agency, so I apologize.
No, that's fine, we agree.
But if you would loosen up on some of the rules and regulations, and what is the goal, and how can we measure outcomes, instead of having done line 16, paragraph 14, exactly right, and then dinging everybody, there's the victory.
I agree completely. This is why I said earlier in answering Larry's question, we want to hear everything. We want to hear what works. I made the distinction between state administered agencies and locally administered, where a lot of things happen at the local level that the state might not even be aware of. I fully concur. Now, I would be doing you a disservice to say we're going to throw everything out the window and we no longer have rules. As a matter of fact, when we did our visioning map in Delaware, we were that lofty, and we threw away the rule book, and of course we couldn't do that. We are a nation of laws, and in order to have transparency in government, you also have to have a lot of accountability. And there has to be the challenge for us is where is the right balance? Where is sufficient regulation to assure the taxpayers that their monies are being spent wisely, and sufficient flexibility so that we can do what the people need for us to do with them? And that's what we're striving for. I don't have the answers. I didn't come here because I had the answers. I, like you, and so is our team at all levels, struggling to find out what is it that we should be doing, how best should we be doing it, and we need your help. And I'm very willing to listen, and that's why I'm here. So I fully agree. Where are you from? Alabama. So send us ideas about what is working for you, and we'll be happy to look at them and explore how we can expand that more to scale.
I wanted to make a comment on data resources. I'm from the Medicaid program in New York, and I don't know how many people in this room personally know Rick Friedman at CMS.
Wonderful guy.
Rick is an absolute visionary, and we've sat down with him and talked about how to use the Medicaid data resources to expand it across the whole spectrum of human services. And he's come up with some great ideas. So I think at the federal level, there's a huge opportunity for you, to sit down with CMS and work at a federal architecture and regulatory scheme that allows Medicaid agencies to really open up the tremendous data resources that we have and expand it out to our sister agencies. That's why our New York team that came here today consists of Medicaid and our Office of Children and Family Services and our Office of Developmental Disabilities, because we're trying to do that in New York, using the Medicaid resources from the data perspective to really encompass the whole spectrum of services that we're delivering to the same patients and the same families. And I think at the federal level, Rick has got exactly the right ideas on how to do this. He's a real visionary, and I know some of his staff are here. He couldn't make it to the meeting, but I know he would echo this because we've sat down with him and had these conversations in Albany about doing this. So, he's a real champion for this. So
he's very open, and he's been wonderful in creating that climate. In Puerto Rico, we were able, in spite of all the requirements that Puerto Rico has, that is any state up to the 10th exponential, we were able to use Medicaid dollars for child welfare in unprecedented ways, thanks to ideas that he shared with the Medicaid agency there that we had been asking for, begging for, but we had not gotten anywhere until he said, yes, please go ahead. And similarly, we are now trying to bridge gaps between SAMHSA, Medicaid, and child welfare, and TANF. We're all looking and exploring ways, and there's a lot that can be done. Yes.
Can you talk a little bit more about your Caring Communities for Children initiative and whether you're bringing in the health side as well on that one?
Yes, that is the idea, is to look at child development in a very comprehensive way and to say to communities, we're all talking about place-based initiatives. Well, this is our idea of place-based initiative, bring forth a mixture of rich resources to one geographic area and then see how it blossoms and how it can all be brought to bear on behalf of children. So we're saying we do not have billions of dollars, 37 or 38 billions of dollars like beacon communities, but we have expertise and we have ideas, and we can put our TA contracts at your disposal if you are willing to bring together leaders in your community in the health, education, child development, social services, substance abuse and mental health services, and see how we can come together as a community and establish a plan for creating the environment that would help children flourish and thrive. And this is what we're doing. If it works, then our hope is we can then go in the budget and ask for money to support those initiatives. Really, the first budget that we will really own, and when I say we, I mean Carmen, David, Frank, the ACF leadership, will be 2012. Because even I got confirmed September 24th, and the 2011 budget was already gone. And so 2012 will be our first real budget. Yes.
It's so wonderful to hear your support, your interest in support for ideas. And just to offer a suggestion, some of us are from Los Angeles, and we have our colleagues from Alameda County in California with us, and we've had the benefit of a title for e-waiver. And just to offer a suggestion about, a convening of those folks who've been engaged in waivers, who are interested in waivers and broadening waivers, we'd be very, very, very eager to speak with you about the level of progress we've already made and the exciting ideas that have come out of meetings like this, where we begin to bridge the different funding streams and to use the flexibility to do exactly what you're talking about, to demonstrate the outcomes on very local levels. This has been a very inspiring meeting to hear about the local work that's being done. And if we can bring all of that to your attention, I think there's a lot of ideas out there that you may find very exciting.
I look forward to that. What is your name?
I'm Lisa Parrish. I'm from Los Angeles, Department of Children and Family Services, but there are others around the room who have been doing so much great work. Uma in Montgomery County, our colleagues in Alameda in California, all of Florida, and the Medicaid waivers. I mean, imagine combining Medicaid waivers and child welfare waivers and looking at longitudinal data to really demonstrate the effect of that. I'm trying to get it all in, Barbara.
She paid you for that, I know. I saw her talking with you at breakfast.
Thank you for your support.
I will look forward to that. Count on that. We will convene all the waiver agencies, certainly at least initially the 4E waivers, and then move from there. Excellent. Thank you. Yes, Jerry?
I want to join the chorus of thanks, Carmen, for your openness and willingness to come meet with us. And just to say that I have, with every new administration, we always kind of get new appointed officials. But what I have seen that has really been different is there really has been a bias to action. Things you don't read about in the front pages of the newspapers, the interpretation of the maintenance of effort that really helped states with TANF, the behind-the-scenes work on the Medicaid regulations, the willingness of David to come and get on the phone with our members routinely about new and upcoming things, the flexibility with the TANF emergency funds. I mean, it's just really wonderful, and I really want to encourage you and let you know that we want to be your partners as we get on that path. I'm also very excited. Another hat that I wear is to serve on the Rural Research Policy Institute's Human Services panel. And I think that there's a lot of work that can be done in rural America that can both inform as well as benefit from the work that you're doing. I have seen tremendous innovation in rural communities, mainly because they didn't have the luxury of not working together. On the other hand, there's a new element, I think, with broadband and broadband access that not only will increase our ability to provide services, but I think it's going to increase the demand for services. And so I just kind of want to put that on the radar screen of your work groups and let you know that we, through the Rural Research Policy Institute, are very willing to work with you. We've been thinking about this for a long time. What will this level playing field electronically mean in terms of service capacity, service demand? So thanks again.
Thank you so much for your very kind words, and all that does is put the pressure on to continue that further, and we will.
We'll do that, Carmen.
Thank you.
Carmen? Over here.
Hi. Jerry, is it right?
Your openness is important to the work that we're doing, and the whole idea of blended service delivery has been around for some time, but welfare reform is a major driver in some of the accomplishments as we've made to date. And I'm interested in what's been going on at the federal level among the federal agencies in terms of interoperability, and whether or not there's a focus on, my concern is the target population of people in need that have actually benefited from welfare reform. They're the most fragile group right now in terms of the current economic situation, and yet they're kind of the hopeful paradigm pioneers for furthering the work and keeping it going for others. And so can you talk something about how the federal agencies, the other concrete agencies, the Department of Labor and so forth, are thinking about interoperating around that group?
They might not refer to it as, interoperability and interoptimability. They may not talk about it in those terms, but it is the same openness because, as I said, not only the president wants it, but he has put people in leadership positions who are committed to the same agenda. And so therefore, and we're lucky we have Kevin Concanon at USDA, or another one of us, and that openness is there among the other federal agencies. This is why we're able to have so many working groups and why we have these initiatives going on, some of them spearheaded by the White House itself, like the Rural Initiative and the Urban Initiative. But also, among the agencies, the HUD working group and the Labor working group and the USDA working group, they grew out of our mutual interest in openness, in looking at, why is it that U.S. SNAP caseloads have grown so much, and the TANF caseloads have not, when the people, where are the requirements? Where are the barriers? It's not like we are having the money that we want all the people to come, but why? That's an interesting phenomenon. Where are the inconsistencies in the requirements? I was talking to Kevin one day. We're having lunch with Kevin Concanon, and I'm complaining to him. I'm whining like, "Oh, David, I find it so hard. I find it so hard to get a change through, and everything has a requirement and a barrier." He says to me, "I don't. I can do anything I want." I said, "Well, then we need to get together so that we can lobby, particularly with reauthorization, getting back to that flexibility that, hey, remember TANF used to be a block grant? How do we get back to that? How do we bring in that flexibility?" He said, I can do anything, almost anything I want. He's like, well, I want to be in that position. So, we have the same interest, the same commitment, and we're working towards that. I didn't talk a lot because I've mentioned in so many other places, but the openness with the Department of Education. We are now writing into law joint administration of a statute. There's no precedent for that. There's no rule book on how we do that. Who writes the checks? Who gets the money? Who writes the policy? This is very exciting for us, and we're doing that with the Early Learning Fund. And regardless of whether that bill passes or not, we're hoping that it will pass the Senate. It already passed the House. But even if it doesn't, what we have gained in how to do this level of collaboration is of immense value to us. And regardless of, that is $8 billion over 8 years, but we have Head Start and Early Head Start and child care programs, and they are much more funding, much bigger funding than that. And so regardless of whether that bill passes, and I don't want it to be interpreted that we don't care, we do want that bill to pass. But what I'm saying is we've learned and gained so much in working with our sister agency in the Department of Education for Early Childhood. So I'm very excited about what's happening throughout the federal government.
I think one of the questions that came up yesterday morning after Professor Doug Ray spoke and gave us sort of a political, historical perspective on change and innovation and the challenges with that was brought forward.
He must be a lot older than me.
A lot older. He brought it all the way back to the birth of Christ. So one of the questions that came up, which was it's resonated with me and in the conversations I've been having for the last couple of days, is how do you sustain innovation and risk-taking within a large administration, a large bureaucracy, when so much of the mentality is to not take risk, to get you, and to really quell that kind of enthusiasm. And so he didn't actually have an answer for that, which was, indicative of how good a question it was. And so what I'm hearing is almost a response to that question now, which is the efforts that you and the other leaders in Washington are taking by action and by demonstration are saying, we're going out on a limb, we're going to do that. And so by example, you're setting a tone that I think will hopefully resonate with both people in this room who are in many roles of leadership and are on the precipice of taking those kinds of risks. And so I want to acknowledge that both for the group here and just to let you know that that's resonating well with, I think, the conversations we've been having over the last couple of days, because that's fundamentally the basis of what you're asking for, is to bring it forward.
Thank you. At the risk of pulling the rug from under you for that, giving us that credit, I agree with that, and that's the way I'd like to think, and I appreciate that recognition. At the same time, I think it takes all of us in this room and more to be sure there is an inherent tension, particularly in the first term. There is the momentum. We want to get a lot of things done, and the president has set that tone, and so has the secretary in our case. And that's obviously there, and it's propelling us. Many of you in this room will remember Barry Van Leer. Barry came to visit with me and David in my office, and we were reminiscing on the days where some of us were trying to do these very same things, but we were doing it surreptitiously. It's like the deputies would get together and said, forget our bosses, let's do this, because it was so obvious that we needed to work together. Well, that's not the case anymore. Here are the bosses saying, go forth and collaborate. And so that's a whole different tone and a very permissive and encouraging tone. At the same time, because it's a first term, well, I should say, back up one step, is the additional blessing is that in some cases, the people like me who are at the end of their careers and have nothing to lose, Kevin came out of retirement, to do this job. And so, hey, we're going for it. Permission to deputies and program heads to say, go. I say to David and to Joan and to Mark, go for it, go, and just give them that openness to go forth and do wonderful things. But there is a risk that because it is a first term, that, we might say, well, wait a minute, don't go so fast, pull back. And so it takes a lot of public pressure from states, localities, and to say, hey, we want this, continue this, we have to do more, and continue to put the pressure on. Otherwise, there's always the risk that people are going to begin to pull back. It's like you hear it from both sides. You hear, he's trying to do everything, or he's not doing enough. And so. One more?
I have to ask this one question, and I've been wanting to ask it over the whole conference, so you just happen to be the person who's standing up there who gets to hear. Thank you so much for your service. I wouldn't want your job or any of the new appointees' jobs, because I feel like on the one hand, there's this great openness being encouraged, and on the other hand, I'm not sure for what. We talked, I think yesterday or the day before, about how many other countries are far advanced to the United States in many ways, and one way is that they have a national child and youth strategy, a clear, articulated policy, set of policies that speak to the benchmarks that we want to see for our young people, sort of where we're trying to go, what the outcomes and the indicators are. We don't have that in this country. Sort of each department is almost a nation unto itself. So I guess my question is really, do you see a value or a need right now for some sort of a national child and youth strategy that really clearly articulates what the vision is that we have for young people in this country?
Well, I agree with you only to a certain extent. I know Michael Petit has been advocating for that one single national strategy. I would differ with him, and I have said this to him. I believe, on the one hand, that we do. There's no question that it can be improved, needs to be improved, should be improved, takes all of us to improve it. In terms of a strategy that we are for safety, permanency, well-being of kids, and what that means, we do have that. And we do have laws in this country that are the envy of many nations and policies. I think we need a lot more funding, certainly for CAPTA. I think that we need to go to some localities and work on implementation of those strategies and those values, and that we need to raise the floor in terms of some geographic areas in this country and what's happening. None of us like to hear when, a child dies in spite of having been visited 110 times. And so there's no question that when we're dealing with this difficult, complex issue, which we could stay here another 3 days discussing, and I'd love to do that sometime, many areas for improvement. But I do believe that as a country, we know that we want to protect children, and we want children to survive and thrive. I think of it as a big pot of stew that is boiling. You're making stew. You have different ingredients, and it's big and encompassing. And there are some bubbles will rise to the top, and are big bubbles. And there's some little ones that are trying to come up. And you do not want to say only this one big bubble is going to be the one. You want to see what comes up. As long as you have a minimum floor, you know that you're not going to let anything below this be acceptable. And we've even taken on cultures that are different from ours, in which some things are acceptable, but in this country they're not. And so I'm encouraged. I don't think we're there. I think we have a lot of room for improvement in terms of implementation and funding of child welfare services. And I think the system needs to be greatly improved. But I'm also not in the group that says other countries are more advanced than we are in terms of strategies for children. Certainly not in the way in which they are implementing those in terms of child protection. Now, I'll grant you that in certain areas of child development, like paid family leave and, those things, I agree. But they're also not to the same scale as the United States and not to the same costs of the United States. And so, we can try to learn from that. Last night I was talking to Dr. Ed Ziegler, who says 1,500 schools are now implementing his model, or at least a model in which he participated with others in crafting. The schools of the 21st century model, in which we begin with children from birth and do home visiting, and then at age 3 you begin in pre-K, and he said 1,500 schools are now implementing that philosophy. Well, that's not enough when you consider how many schools are in the United States, but at least that's an advanced way of looking at it. For the first time ever, we have home visiting, mandatory grants on the formula side of the budget for home visiting. I mean, I think that's great. When you consider the scale of this country, it's not like taking a tiny country in Europe and saying, okay, we're going to do this. And so, I'm encouraged. I think there's a lot of room for improvement, but I'm encouraged. And I think we just have to continue to work on it.